And action! John had a question about slow exercise. I don't know if there's a category for slow exercise, but it is actually the concept of exercising or doing your body part movements, especially if you're injured, like John. Shin splints is an injury. Specifically, before I get off that topic, overuse injuries or shin splints injuries usually occur first when you're running, the activity. And then it occurs when you're running and a little bit after. Then it occurs before the run, when you run, and a little bit longer after. Then it occurs at rest. When it gets to the rest stage and you're having pain, then you're out, you're injured, which is the case here. But me telling an athlete to not exercise at all, first of all, telling a runner not to run, so sometimes to keep the psyche busy and also to keep the heart in condition, I'll have my athletes cross-train. Just because you're on the bench or sidelined doesn't mean that you don't have to exercise. I think, like in the case of shin splints to the calf or one of the compartments of the foreleg, you can still work thighs, you can still work upper arm, you can still heel pedal without putting any movement up in dorsiflexion or plantar flexion. The objective is just to be very careful with your movements. Otherwise, you could just cause the injury to occur and you'll never heal up. So as I was saying, back to the bench press or pec exercise. Sometimes the best kind of exercise is controlled movement, isometric. Jack LaLanne exercises that I just did a tutorial on. They were I showed you some of the cheap exercises that I do when I don't have access to a gym. So something like a plank. You can do a plank that will indirectly affect your pectoralis muscles, and or affect your triceps, but it'll also affect your core, your abdominals, your trunk. You have to keep that stable in order to keep the position. At an incline, it might not be the same kind of pressure or force that you generate with flat planks or push-ups, but it's still work. And when you work muscle, it causes lactic acid buildup and breakdown of muscle tissue. That's in effect what we're trying to do. If you're trying to cross-train while you're injured, working on your weaknesses would be the best thing to do during that time period. So, for example, running backs, guys who sprint really fast, usually have big muscle. What do we do when you cross-train or when you're injured? Work on flexibility. Gymnasts who are super flexible, or dancers who are super flexible when they have a knee injury or a foot injury, what do? Work on power. So you have your different options, but this is just one. Going slow and concentrated does give you a pump, mostly because when you're used to a lot of fast movement, for example, a typical thing with fast movement is biceps. I think I did this before my Jack LaLanne exercises, but bicep curls, usually you'll develop some momentum. These are only about 5 pounds, but with the momentum, you can actually swing the body and get a little bit of cheat when you're specifically strict. When I was bodybuilding, I used to do one of my favorite exercises, especially before competition or going on stage, was concentrated curls. So usually you'll take the movement, go super slow, but I was told to concentrate on contracting the entire muscle, working on the forearm, making sure that you're contracting properly and getting feedback between hand-eye, and going ultimately slow with the same weight that I'm used to with regards to this, the body part or the movement. But when you go ultimately slow, work on form, two things happen. You won't do as many repetitions during your set of exercise for that body part, but you go slower. When you do this, you ask muscles to be recruited. That's when the actin myosin fibers are contracting on themselves. So calcium is going in, but with the movement, you're also expanding. You're allowing blood flow in and out. So the muscle, remember, the muscle also causes a push-pull effect. So it's sucking out and pulling in more blood flow. What happens when you have that blood flow? Lactic acid goes away. So that's why you can sometimes push out a lot of sets and then eventually burn out at the end because the muscles are just fatiguing and you're using up all your ATP. But in the case of slow movement, you're not getting that pump effect, so you're actually building up lactic acid. That's my theory. I don't have any randomized controlled trials, but one of these days I will. But because of that theory, because you're strict, you'll have a bigger pump. It'll give you the sensation of having that swollen effect, but you'll still have a workout. And because you still have a workout, it's a nice feeling. I bet you'll be able to recover faster and get back to the same thing the next day. But again, you're avoiding the injury, developing a body part that you either aren't used to developing or you are weak in that body part. There's two different things. So that is an option. Some of my bodybuilders will not like using slow movement because, especially powerlifting, nobody likes to lift that much weight with and hold when you're in a precarious position. In the case of exercise, especially this form, the idea is to hold as best as you can. You'll feel the shaking occur, but you feel the burn and you push or breathe out. Concentrate on breathing, concentrate on form, straighten out or flex or contract any other body part that can be useful. Hopefully you get past the burn and then you rest. Recovery is always important. That's essentially what we do when we're working on yoga. Yoga, you get into a form where you're like in a chair pose, you're holding a position for a long amount of time. And it doesn't seem like it's too big of a deal. But after about a minute, 3 minutes, your thighs are burning until you're only thinking about your thighs. And if you think about your thighs, they'll burn more and you'll fatigue more and you'll shake more. And then the stress response comes out until you finally let go and get out of the position. So all these exercises are meant to go slow. When you go slow, you're purposeful, you won't get injured, and you're also still working your body part. And I'm a little short of breath, so I can still get a pump, and I didn't really do anything. There's one pose called Warrior 3. It's said to cause the most blood flow and fast heart rate because it's such a strong pose. Every body part has to be contracted. Then you're also working on balance, which most people aren't used to balancing that much weight in a weird position for a long amount of time. So after you get out of the pose, you have that rush of endorphin, adrenaline, fast heart rate, and you get a little bit of a pump. So these are the things that I would do when you're injured. Sometimes having cross-training in another sport instead of running, cycling, instead of cycling, swimming. You can always do that as well. But it's always the design or the designer that has to get you something that won't injure but yet keep your mind and your body helpful, handy, and involved. So good question, John. Hopefully this gets you to the next level, but don't forget, you still have to eat, still have to sleep, still have to do everything else that you do to be an athlete.